Hello friends, today we are back with another topic, important topic, that is low back pain or back pain, which is unfortunately becoming common. So what are the main symptoms in a person who has back pain? So typically they say that the lower part of the back, it starts paining, especially when they are sitting for a long time or standing for a long time, or in some when they start moving. And there are no clear cut reasons why it happens in them. So but when the severity increases, many of them can have the same pain which radiates to the gluteal region, that is buttocks, thighs, and even the legs. So the pain can start in the lower back and go to the legs also. Now if you look at the main causes, when we analyze them and we study them, the commonest problem we find is the what is called a slip disc. So the slip disc means we have, if you look at the vertebral column, the back, so between the bones there is a tissue between the bones called as disc, and that disc over a period of time can degenerate, become weak, and then slip out from its place. And on the sides of the spine there are nerves which travel to the gluteal region and the thighs and the legs, which get pinched or compressed, and then the pain starts. That is the commonest reason. Of course other reasons like back muscle spasm and a few other reasons, also osteoporosis or osteomalacia when the bones are weak, muscular weakness, so those things also can cause, or any trauma, injuries to the back. So these are the other causes also of back pain, rarely infections. But out of 10, almost 8 people it happens because of degenerative spine problem, which is the spondylosis or the slip disc, or commonly also called as sciatica. Now we look at why it is becoming more common. So about 30 years back, back pain was not so common, but today these are very common. Almost daily I see 4 or 5 people suffering from back pain. It is that common, and I'm sure other doctors also see good number of people with back pain. So I feel the commonest predisposing factor is our sedentary lifestyle, and that is because of the jobs that we do today. So most of the jobs require sitting for long duration, and anyone who sits for more than say 10 hours in a day is a risk factor for developing back pain. And second risk factor I can see is also prolonged driving. So there are people who have to drive for longer distances to reach from home to office and back. So longer commute times for the office work could also be a risk factor. And thirdly, if you look at somebody who joins a gym or doing some work without proper form or guidance, so they can hurt their back, and the slip disc can occur if they are lifting heavy weights, and if the training is not properly done. So that could be another thing. Those who are engaged in sports activities, they can also suffer injuries while playing a sport, and that can lead to slip disc and back pain. And so these are some of the more common causes. In a slightly older age group, what we see is because of the bone weakness and even the degenerative effect of the age itself leads to slip disc, and so it is more common in older people. And not to forget overweight and obesity, because as you can see, the entire body weight has to be borne by the spine, and lower spine, that is lumbar spine, bears most of the body weight. So it is more common in people who are overweight or obese to see a slip disc issue. So now that we have enumerated so many predisposing factors, now we look at what other symptoms can happen in people with this condition. So back pain and the leg pain I already mentioned. Other things can be what is called as tingling, pins and needle sensation, which can occur in any part of the leg. Numbness, a part of the leg or the foot can become numb, and if the nerve is pressed too much, there can be weakness. So the foot, there may be difficulty in moving the foot up and down or the toes up and down. And finally there is something called as bladder retention, where the urine symptoms also can start. So that is quite severe stage. So if any person has any of these symptoms like back pain, leg pain, tingling, numbness, or weakness of the leg or foot, then you should consult a doctor so that it can be diagnosed. And for diagnosis, in addition to clinical examination, an MRI is usually done, which can confirm the diagnosis and the severity of disease. And that takes us to the treatment options. So treatment options initially, of course, if the condition is severe, person needs to take rest, and then we need use various medications to relieve the pain, which are quite safe. Then there is a role of physiotherapy, where there are techniques to relieve the pain as well as to strengthen the muscles of the back, so that the further degeneration or further worsening can be stopped. And then in some cases, if these measures fail, that is about 80% people do respond, but 10 to 20% may not respond. So they may require something called as epidural injection, where injection is given at the back where the nerve is pinched, and less than 10% people who do not respond to physiotherapy, medications, and the injections, they may require surgery. So surgery is the last resort, not really the first resort. Surgery can be the first resort in people where the slip disc problem is very severe. The person is on wheelchair, cannot walk, or has already developed weakness or numbness of the foot, or there are bladder symptoms. In such cases, we cannot wait for the medical treatment. Surgery should be done immediately. But that is, as I said, less than 10% of people. So now that we have discussed, the symptoms, predisposing factors, and the treatment, but those who do not have back pain, can be prevented? Answer is yes. So there are many changes, many things, many precautions we can take in our daily lives to reduce the incidence of back pain. First of all, is reduce the total duration of sitting. Now, one cannot reduce the working hours because that is usually 8 hours. So, the leisure time sitting. So, post work, many people sit and watch TV, many people browse internet and social media. So, that timing can be reduced to say less than 2 hours. So, totally it becomes 8 plus 2. So, below 10 hours is ideal. And even if you're watching TV, or possibly you can stand and watch, there's no need to sit at that time. And in the office also, we have to try to take a break, say every 30 to 40 minutes, get up and move around for 2 or 3 minutes. The coffee breaks can be in standing position. And if you have meetings in the office, there also you can stand and discuss things. And now many offices, they have facilities for standing working desks also. You can stand and work. So all these things we can, they are small changes, but this can help definitely in our daily lives. Other is those who are overweight or overweight or obese. They should take precaution to alter their diet, reduce the carbohydrates, and also do exercise to lower their body weight, and that also will reduce the risk of having disc prolapse. And people with calcium deficiency or vitamin D deficiency, they should check their blood levels and correct them if they are found deficient. So these are some of the measures which can be used. And then not to forget the back extension exercises. Even those who do not have back pain, they should do the exercises to strengthen the back and the neck muscles. And if the muscles are strong, then the risk of slip disc also will reduce. So as you can see, there are many things we can do in our daily lives to reduce the risk of back pain. So, and then in most cases we can reduce or prevent the slip disc problem. But in case you develop symptoms, do not ignore, consult a doctor so that it can be properly diagnosed and the best treatment can be started. And the good thing to know is that you need not worry. Even if somebody has these problems, there are excellent treatments to give you adequate and good and the prompt relief. Hope you learned something from this talk, and if you enjoyed it, please like and repost, reshare this video. Thank you.